Today, we're going to talk about the spine. But this isn't your typical story about back pain. We're looking at two completely different and pretty terrifying ways it can all go wrong. One is like a lightning strike. It happens in a flash, a total catastrophe. The other? Well, that one's more like a slow, silent squeeze that creeps in over decades. It's a real tale of the sudden versus the slow. So let me ask you this. Can one lesson, just one single experience, change your entire life forever? For some people, the answer is a heartbreaking yes. A single day, a brand new activity, it can lead to an outcome that absolutely nobody saw coming. Let's dig into how that's even possible.
So our first story starts in the ocean. Picture it. It's a perfect day. You're trying a surfing lesson for the very first time. The sun is shining, the waves are gentle. It's a dream, right? But for some beginners, this perfect day is about to take a turn into an absolute nightmare.
And here's the thing. The people who are most at risk, they're usually young, they're healthy, and this is the crucial part, they're complete novices. It's their very first time on a surfboard, they're just full of excitement, and they have absolutely no idea what kind of hidden danger is waiting for them.
So what are they doing? They're spending hours, literally hours, lying on their stomach, paddling, arching their back to look for those waves. And that one thing, that prolonged hyperextended posture, that's the trigger. It's a really unnatural position to hold for that long, especially for somebody who's not used to it.
And then it starts. But it's not a big wipeout or some dramatic impact. Nope. It's something you could easily just brush off. A sudden, sharp, cramping pain deep in the lower back. You might think, oh, it's just a muscle strain, but it's not. It's the first alarm bell of a neurological emergency. And the progression is just terrifyingly fast. We're talking minutes here. Within minutes of that first pain, a tingling feeling starts to spread down into the legs, and then weakness follows. Before they can even process what is happening, they're paralyzed. This terrifying condition actually has a name. It's called surfer's myelopathy. And get this, it's not caused by trauma, like a fall. It's an ischemic injury, which basically just means the spinal cord is being starved of blood and therefore starved of oxygen.
So, you have to be wondering, how can simply lying on a surfboard cause such catastrophic damage? Well, the mechanics of it are frighteningly simple, and it all goes back to that arched back. Okay, here's a really great way to picture this. Think of your spinal arteries as a garden hose, and your spinal cord is the garden. That prolonged arching of the back can literally create a kink in that hose, cutting off the vital blood supply. It all sets off this insane chain reaction. First, you've got the hyperextension, the back being arched too far for too long. This compromises a key artery that feeds the lower spinal cord. Then, the cord is starved of oxygen, and within minutes, the nerve cells just start to die. The damage is swift and it is severe.
All right, so let's pivot away from the sudden shock of surfers' myelopathy. Now we're going to talk about a threat that's far more common, but much, much more insidious. This is an injury that doesn't happen in minutes. It happens over years.
You can really see the stark contrast here. On one hand, you've got surfer's myelopathy, which is acute, meaning sudden, and ischemic, so it's about blood flow. On the other hand, you have cervical spondylotic myelopathy, or CSM. This one is gradual, it typically affects people over 50, and its cause is compressive. It's a literal squeezing of the spinal cord. So what is CSM? Well, you can basically think of it as arthritis of the neck that gets so bad it actually starts to squeeze the spinal cord. It's the result of decades of simple wear and tear.
So if surfer's myelopathy is a kink in the hose, CSM is more like a rope, the spinal cord, being slowly squeezed and frayed over a very, very long time by things like bone spurs and bulging discs. The damage is cumulative and it's relentless. It's a silent crisis that unfolds over decades.
Okay, so we have two very different injuries here. How are they treated? For both of them, time is absolutely critical, but the approaches and the outcomes can be worlds apart.
This data from a case series on surfer's myelopathy is just stunning. So one patient was treated with something called induced hypertension. Doctors basically raised their blood pressure to force blood past that kink in the artery. The result? An almost full recovery. In contrast, two other patients got high-dose steroids, which is a pretty common treatment for inflammation, but they remained completely paraplegic. It's such a dramatic example of how the right, immediate intervention can change everything.
Now for CSM, the race is slower, but it's just as serious. In mild cases, physical therapy can help manage the symptoms.
But once things start progressing, surgery to physically create more space for the spinal cord is often the only way to stop the damage from getting any worse. The goal isn't just recovery. It's about halting a slow-motion disaster that has been years in the making.
Now, both of these conditions are frightening, of course, but awareness is your first line of defense. It's about learning to listen to your body, whether it's shouting at you in sudden pain or just whispering with subtle new changes. So what are the key takeaways for you?
For anyone thinking about trying surfing, please remember this acronym from the Surfers Myelopathy Foundation. It's SPINE. S is for sit on your board while waiting for waves. P is for pace your time in the water. I is for insist on a knowledgeable instructor. N is for notice any back pain. And E is for exit the water immediately if you feel anything. It could literally save your ability to walk.
And for that slower thread of CSM, the signs are much more subtle. They're whispers. Things like trouble with fine motor skills, like doing a buttons or your handwriting getting sloppy. Feeling unsteady on your feet. New numbness in your arms or legs, or even changes in bladder control. These are not just signs of getting old. They are red flags that your spinal cord might be in trouble. Do not ignore them.
So, whether it's a sudden, sharp pain during a new activity or a slow, creeping change in your daily abilities, your spine communicates. It's always talking to you. The crucial question is, are we choosing to listen before it's too late?